My name is Dr. Caroline Ngugi. I'm the Director Training, Research and Partnership at Kenyatta University Teaching, Referral and Research Hospital. Did I first realize or other people realized? So from where I sit, it's actually other people who realize. I may have realized, but I didn't know. I used to think if you're deaf, you're deaf. If you can hear, you can hear. There was no in between. So I met my husband years ago. And I remember, I think our first arguments would be he's talking to me and I'm not responding. So he used to think I'm ignoring him. Then I think in his wisdom, he used to tell me to try and go for a hearing aid test. I have a problem with my hearing. And I just ignored him. And then I got my little kids. And one time they come from upstairs and they come and ask, why is the TV that loud? I could barely hear it from where I was sat. So at that point, he looked at me and he says, I told you, you need to get a hearing test done. So that's when I had my first hearing test, and I did my tests and I was told that I have some hearing deficiency, if I can call them that. Now after that is when I started looking back at my childhood. Where did I sit in class? I wanted to sit at the front so that I can hear. So I guess that's where when I first realized. This has been about 13 years now. It wasn't easy in the beginning. When I did my test and I was told that I have a problem, I went to the car and I cried myself out. Then now I went back, I just sat in the car, cried myself out, went back to the doctor, now to understand what are the next steps. So he gave me the options and he said, well, we'd have to do more tests. But option was surgery, but he proposed I do surgery or getting hearing aids. And then he told me they have cosmetic ones that you put inside your ear and nobody can see. So I was given those hearing aids. And for years, I didn't tell even my closest friends and my family, I didn't tell them about it. So I would refuse to wear them all the time. I would walk into meetings. I used to have problems when in meeting rooms. That's when I would not hear. So I would walk into meetings and, hide myself and put on the hearing aids. As soon as I leave the meeting, I remove them. So it took me a long time to get used to wearing hearing aids. They're very uncomfortable at the beginning because you're hearing things that you were not hearing before. So you think the noise now is too much. But the doctor and I walked this journey with my doctor. He kept encouraging me and telling me to wear them often, just to get used to it. The challenges, I would say, is the cost of having the hearing aids, acquiring them, and getting the best. Of course, there are different categories, but given the work that I do, I find I need a good quality pair of hearing aids. So they're not cheap, as I mentioned. The regular checkups are also not cheap, and some of the insurance cover that cover us do not cover for those checkups or those tests. So that has been the main challenge. My request to the government is to look at ways of reducing the cost of hearing aids. The amount we're getting from SHA is very little, and it only covers if you have two people in a family who require hearing aids, what it's giving us is not enough. So the government really has to find ways of subsidizing the cost of hearing aids, and especially for young children. I have developed an interest in just understanding hearing loss in children, hearing loss in our society, and just trying to find out how I can give back to the society. So through this, you realize that a lot of parents in the community, they don't want to accept that their children have a hearing disability. So they maybe not understand, and they're speaking to their children. When you speak to some of those parents, they'll tell you, I used to speak to this child of mine and I always used to think my child is kichwa ngumu, hard-headed. They're not listening, they're not responding. But I wish that, hearing testing can be integrated into antenatal care that we give to mothers. Even before when a mother is pregnant, all the education we get about pregnancy and after pregnancy, during immunization, because mothers get that education. So I think it needs to be integrated in that education or into our young children care health. So if that education could go out to all mothers and fathers, so that you identify these when your kids are young. In terms of people acceptability or society acceptability, I don't know, but every time I meet somebody and I tell them that I'm a person with disability, you find that people will always look at you like, what disability? You look fine. I mean, what is it that how can you be disabled? So yes, but once you explain, and they find people who are trying to see how are you hearing, they even ask you to show them your hearing aid. But I guess it's just society. When I look back, and my parting shot would be to tell everybody as we celebrate, it doesn't matter whether you have this disability, it is an advantage in many ways because you're going to have 2 extra ears and you'll have 2 magic ears. So we can celebrate each other, we can celebrate our disabilities and encourage each other to know that there is support. And I'd like to wish everybody a happy World Hearing Day 2026.